Ukienda kuongezea nilikuwa nikuulize, kuna wanaume ambao pia wanaogopa kupimwa. Hao tunawasaidia, wengine wanangoja mke wake au mjamzito aenda apimwe ili ajue. Ndio kweli. Hao tunawasaidia.
I think one of the reasons why we are seated here is to start a conversation on how we can reach them. And one of the things that we have discovered, we want to start taking services to where men are. And where are these men? They are either in the alcohol dens, and where? Unapatikana wapi wanaume?
Kwa police.
Kwa haso, kwa soka, si ndio? So if you look at the activities we have night in our World Exhibit this year, we have brought in the idea of having some football tournaments and some athletics, such that we attract these men to give them what? Information, because information is power. So then there is a lot, moderator, that we need to do. We need to start a serious conversation on reaching men. It cannot be left to the hospital or to doctors alone. It is for all of us, the media, the stakeholders who are here, the community people who are here. This is the message we want to tell them, that the behavior, the health-seeking behavior of men is not up to date. So, hata wale wenye tumeketi here, tunataka tujiulize, what role have I played as a man? When your woman is pregnant, she goes to the clinic, anakuambia amepimwa, the way doctor is saying. So you end up owning the results of that woman. Unasema kama yako ilikuwa negative, so even me I'm negative. Not knowing the discordant things and other things. So there is a lot that we need to do around men, and it is to start with very serious conversations in our churches, in our groups, wherever we are, even in our college here. Thank you.
Asante sana, makofi kwa Licha. Nadhani Libya hujashika microphone. Na kwa kazi yako ya Deputy County Reproductive unakumbana na haya matatizo mara kwa mara. Unaweza ukachangia nini?
Thank you, moderator. Ningependa kushangia kwamba we have a lot in the Department of Reproductive Health, especially teenage pregnancies. Teenage pregnancies are thrown in everyone's flesh, in every family where you come from, at least or even a neighbor, we've seen a young girl less than 18 years become pregnant. Wako ama wako. Hata hapa vile tuko hapa, hata kama tuko more than 18 years, we're still youths who are supposed to be in university, to solve it, to marry, we get married. But still we get such cases. And again, one thing that I want to mention, these teenage pregnancies, when it comes with complications. We've experienced what we call maternal deaths. Yani wasichana wadogo wanakufa sababu ya mimba ya mapema. Because there are some of their reproductive organs is not developed to carry a baby. So akishika mimba, there are even some conditions zenye zinakuja na kushika mimba mapema. That's why we are here today and we are preaching the gospel. Mimba inaweza ngoja. And if it can't, that's why we are here to tell you that we can use, as youths, we can use what we call dual protection. Dual protection in nini? Who can tell me what is dual protection from the group? Any youth? Dual protection. Nani amesikia hiyo jina mahali? Yes, Naomi?
Yeah, dual protection is why we use planning and
yes. Thank you so much. As youths, we are encouraged, if you cannot abstain, then let's use a condom. Hatuogopi kuongea sawa. Mama hapa amesema, Dr. Lucy amesema, we should not fear talking. If you cannot abstain, then let's use a condom, because a condom serves two purposes. It can prevent the pregnancy, at the same it can prevent the HIV and many other STIs. And on top of that, I want to mention something on top of that, on GBV, gender-based violence. Currently, as we are speaking, in Kisii County or the whole world, we are celebrating or we have activities on the 16 days of activism. On Monday, we did the launch. We want to end GBV, gender-based violence. It has different forms of violence like physical violence. Si wamama tunapiwa? Vijana hapa tunapiwa ama hatupiwi? Wasichana tunauliwa ama hatuuliwi? Are we experiencing femicide in Kenya? Have we seen it in Kisii County? Tumeiona ama hatujaona? Tumeiona, and that's why we are saying when we're fighting HIV/AIDS, it's because of some of the forms of violence like sexual violence, whereby we get young girls under 18, they're being defied. We have rape cases because of the main factors in our community, and that's why we're here today. We want to stand and say, as much as we want to end HIV/AIDS in 2030, we also want to end GBV among women, boys and girls. Are we together? Thank you. Back to you.
Asante. Makofi kwake Lydia. Good. Hashtag end AIDS by 2030. Now, tumesema maambukizi yako juu sana kwa wanawake. Kwa nini hivyo? Why are women more infected than men? Kwa sababu we do this together. Why is this so? Yes, sir. Nani anaweza mpea hii microphone pale? Wacha nikuletee hapo. Wacha nikuletee hapo.
Yes, my name is Henry, Chairman of the International Human Rights Commission. I'll add up 2 reasons why more men die than women, then I'll go to the next one. One of the reasons why men die more than women is that men don't open up, they do not have coping mechanisms with the matters that come in a big way. After getting to know really about their status, many of them collapse, and that is where it ends. That is reason number 1. Reason number 2 is that, these men, including this one, once they have known their status, wanasema kama mbaya. So what happens? Wanaachilia. The more you go into sexual intercourse, the more your viral load goes up. And what happens? You will die quickly because you have simply said, kama mbaya ni mbaya, sasa kama mbaya imepasuka iendelee. So women should know that men who have known their status are very free and very willing to donate and give out. They will die quickly because they have decided to die. That is reason number 2. Then, let me go to the ladies. I have already told you that men who know that they are positive, they get to let loose. They let go. They forget about themselves and they magnify the transmission. So what do? They look for gifts, money, and opportunities to get to every woman. By the way, one man can impregnate 3 women in a day or more. But a woman will only be pregnant once in 9 months. What do I mean? A man can transmit HIV and AIDS to 5 women, 4 women are the number that can be in a day. So that is therefore the reason that you will have, and by the way, women are very conscious. Once they have known their condition, they stay back and look at their children, their family, they start praying, they start asking for God to intervene. They get to really get into like, I'm sorry, it wouldn't have been like this. So then what happens? They restrain themselves. Hawataki kusambaza, siwezi kufa peke yangu. Wanaume wanasema kama nilipata hii, mimi sio mwenyewe nilipata, nilipewa, lazima nisambaze. Kwa hivyo watu wajue, wanaume wakipata wanaachilia.
That microphone should go to Marwanga there. Si amesema vizuri. Asante sana Henry Umweri kutoka Amnesty International. Kule? Ako kule? Yes. Sasa wanaume
My name is Baronga Dennis. I work with Kisii. Yeah, so I think I speak on two issues. Number one, why men tend to die. I'll just read what he says. I think for men, first of all, you are the worst drug abusers. So, compared to female counterparts. Once you discuss any kuchapa, you can get the. Then, Dr. Daly, I want to try to get that pain. So, our men, and we know our drugs, as in promotion of our. Yeah? Then, number two, mental health. This is mental health. I think, but correct if I'm wrong, I think in terms of suicidal rates in Kenya, men tend to do a lot of serious infections. I mean, we tend to use our men more in suicide than our females. So that tells you the issue to do with mental health. Our mental health is not where it's supposed to be, especially when we are diagnosed with a long life chronic issue, a long life chronic disease that comes with stigma. Yeah, I think Kisii will go sana. Some things come into play, especially to do with monitoring game. Yeah, for me, I feel sad because wasichana wanaogopa mimba kushinda ukimwi. Ndio, wanaogopa mimba sana kushinda ukimwi. Na every time leo wanasema fertility pregnancy. Kiona every time you see a pregnancy or a pregnancy, that's a sign of what? Unprotected sex. That's what you see. Sign of protected sex. Now, protected sex, especially for young people. You know, protect the ones who are married and everything. Those who are young, especially in colleges, who are dating, or those who are young, who are being pregnant. And especially for teenage pregnancy. Another thing is, you realize you can correlate. In as much as HIV, we say HIV doesn't affect economic status, but I think there's a certain thing Kisumu realized in some of the Kisumu affect more the HIV than the high economic areas. Yeah? So if a young person, especially gets pregnant, a young lady, maybe is in 12 years old, yeah? But the time I think at 24, how many kids do you think at one? That's number one. And most likely, what usually happens, akishika mimba, babaka atamwambia nini? Enda kumekupatia mimba, si ndio? Na sisi jana vile kuja tukuruka. Si ndio? Hayo si wewe tutapata kumekupatia mimba. Alafu tafukuzwa kwao. Acha kufukuzwa kwao, where do you think they'll end up? Kwa street, si ndio? Kwa street hapa chini. Then most likely, when to get for kids, most likely she may get a pregnancy or she may get an infection. You get what I mean? So I think it's one thing that we have this preventive policies in play, but if you don't address vulnerabilities of our young people, yeah, we may as well fight it and lose the battle. So I also encourage, especially our government, especially those doing economic programs for our young people. Let's make sure, let's try to put money in our young, especially our young girls' pockets. Because I tell Nambabas are maybe not 50K, bila CD. I'll tell you what. Now obviously, young people, sex is not an emergency. Sex is a cause of profit. So, thank you.
Asante Maruanga. Yes, I come to you. Maruanga is from our partner organization, National Endemic Diseases Control Council. Na amesema vizuri. Kuna kitu amesema ya vulnerability ya wagaras. Nitairudisha baadaye kwa daktari Otieno. I know you are dealing with a lot of psychology issues here. Na unaweza elewa hao wasichana kidogo na utuambie. Kuna kitu inaitwa wababas. Ni wangapi hawana hapa? Oh, wangapi hakuna? Okay, mnanielewa. Yes.
Good morning. Before I'm Wycliffe Singer, I'm representing whose body is Kisii, Kenya University's Avenue, Kisii branch. I think by the time you're doing the introduction, they are a group that you know, and they play a vital role towards the prevention of HIV. You have got student leadership, you ought to recognize them. the staff, leaders of the staff, all of the cognizance, but you forgot that. Coming to what, to why men die so fast, all HIV specifically does not kill. What kills people is opportunistic what? Infections. And opportunistic infection will come as a result of reduced immunity. And once man is the provider of the family, and once they get the disease, the immunity of the man will start reducing. Today, if you expose a lady and a man to starvation, put for 1 week for one man, a man will die fast. Why? Because our ladies have got more fat compared to what? To men. The fat will be converted to what? To bring energy through what we call gluconeogenesis. So that also will help men die faster than ladies. Number 2, why ladies are more infected than men? Because most ladies what they also call surface area bone infection. People understand that. Ladies are to receive. Men last to speed. Number 2, the lifestyle of the ladies. The reason makes them move with older people because they want to maintain the status quo. They want to improve their lifestyle. They want their going to know that they're better off. They tend to go with older people, more people, and new people. Thank you so much.
Thank you. Amerusha. Anyway. Yes, daktari. Kuna some comments ambazo mwenzetu ameweka na which I feel pia tunafaa kuziangalia clinically or sijui nisemaje, kitaaluma. Ni kweli kwamba wanawake kwa sababu ya mafuta mengi wanaweza wasi, I'm not disputing the point, but kuna madaktari hapo wanaweza changia zaidi. Dr. Ombole, you wanted to add something?
Yeah, I wanted to emphasize what the gentleman just said. And the ladies in the house, you should take note of this. I told you our prevalence rate in Kisii is 4.4%, but for women it is 5.7% as compared to about 3.5% for men. We are aware there is something called body count. I know men have more body counts than women, but I'm told this is changing. There is something we talked about, the anatomical difference between a man and a woman. You know, your reproductive anatomical differences. That makes the whole difference. You are likely to get the virus entering your body, and I'm talking to the ladies, as compared to the men, because of that anatomical difference. So it should be you who should demand either use of a condom or abstaining or use of PrEP or use of PEP. You should be the ones in the forefront. Because a man can go with an infected lady and I book it. But let me tell you, for a lady, if you go with an infected man, once they have deposited those the spermatozoa in your reproductive system, they stay there, they have more time, and that lining is a mucosal lining. The virus will penetrate and enter your body. So girls, please, and women in general, if you don't take care of yourself, mdanganyo vile Maronga amesema na 50,000, you will get infected. So that is why one man who is positive will infect very many ladies, and like one infected lady, even if she goes with like 100 men, it is not all the 100 men who will get the virus from her. Okay? Yeah.
Asante. Yes, as a daktari anaenda kuongezea, I will also emphasize on what Dr. Ombole said. Na kuna wengine I've met a scenario. Mwanaume alilala na mwanamke na asikia ukweli ni mgonjwa. So this man believes is positive. Ametestiwa kila mahali, anaambiwa you are negative, lakini hataki kukubali. Sasa mental health care yako. Watu kama wao tunawasaidiaje?
Just to add on why more women are infected than men, because of just to add on what Daktari said, anatomical differences. There is also the issue of socio-economic inequalities. We are still addressing vulnerabilities. Generally speaking, you find that women have low socio-economic ability, such that even when they know that they are engaging in risky sexual behavior, they have lower power of negotiating for use of a condom or safer sex. So they will opt to accept sex without condom, simply because of even the age differences. If somebody is elderly with a young girl, the girl will be shy, will not have the ability to negotiate to have a safer sex. Thank you.
Yes, Richard, atakuongeza.
Yes. Nikiangalia mkutano wetu leo tuna wazazi. Do you think we have a role as parents in parenting when we are addressing these issues? Because it seems these things are starting from the family. What is our role? Wamama, wazazi niko hapa na wababa wale kuka yangu ambao tuko na chances. Unafikiria sisi tuko pia na changamoto? Yes. So then, when you are seeing a young man, Mbalwaka anasema anadai 50,000 pale kwa street, wewe mzazi wakati ulituma mtoto wako Kisii University hapa, ile shopping ulifanya ilikuwa isustain huyu mtoto wewe yenye anapatikana huko kwa college. Where do you think as parents? I think we are also relegated our roles as parents. Talking on mental health issues, they also start from the family level. When these kids or when these teenagers are coming with problems to us, how are we addressing these problems? Some of us are very reckless, I'm sorry to say. We don't know how to handle our teenage boys and teenage girls. Kuletea hiyo unaambia usiletee hapa. Hii kazi yako ni kutafuta visi wewe upatikana wapi? Kwa shule. And our lectures here are trying to address this issue hapa wameshindwa. You can see the population we are having at Kisii University. They cannot. So I'm saying and I'm echoing that our roles as parents, we must sit on it and sit properly and address the issues of our children. Thank you.
Asante sana. Ndani tarudi kwa panel sasa.
Issue of the mental health.
Yes.
Dr. Oscar.
Ilikuwa nimekurushia hiyo swali because now she's the psychologist.
Thank you. Listening to my colleagues responding, we realize that as we talk about biology, you know, the biological aspects, the social aspects, mental health cuts across. And mental health becomes very key when we are handling issues of HIV/AIDS for both genders. Why women more than men? I think the answers are clear. Vulnerabilities that we find in women. Basically, even in terms of mental health, psychologically, women remain vulnerable. So, young women who are here, please, as you have been told, you know, Daktari has mentioned about the anatomical differences. I say this boldly. Sex takes place in a woman. And therefore, that predisposes you to infection. So, ladies, take care of yourselves. Again, I want to add also, besides all that has been said, I also want to remind the ladies that you are also vulnerable in terms of gender-based violence. When you go for these parties, bashes, please, you remain very vulnerable because I know even guys in the house, men get raped, yes, but if you look at the statistics, more women get raped than men. So then, in terms of sexual assault, you will find that you may be assaulted by somebody who is already infected. And like it has also been mentioned that, men sort of move on and they say, come and buy. They are always willing to spread it. So you will find more women are the receivers. So this means that knowing that women are vulnerable, knowing that we are vulnerable, we just have to take care of ourselves. Now, in terms of men again and infection, I don't know whether the statistics of the fact that men are poor in help seeking could be also affecting in terms of statistics, so that you find that there's a man somewhere who is infected, but because this man has not sought help, then those statistics will be missing. While women, we have women who will go for antenatal clinics, and women talk about, women are really outgoing when it comes to mental health seeking behavior compared to men. So, seated here, I want to urge men, my colleagues, my students, please go out and seek help, including mental health services. They are available. I'm sure if you seek help, you will always get. Find somebody to talk to. And it has also been mentioned that suicide rate is higher. Completed suicide. Death by suicide is higher among men than women. But that doesn't mean that women do not attempt suicide. More women attempt suicide, but more men die. Those are the statistics. Reason? Because women attempt suicide, yes, but they also engage in a lot of help-seeking behavior. Something that men don't do. And when men decide to end their life, actually they are not joking, they will use lethal means to end their life. So, seated in this room today, we are saying that men go out and seek help, including mental health services, as well as, medical services. Thank you.
Asante sana. Tino, makofi kwake. Good. Remember this message is brought to you by Katie. Katie, nani anajua Katie ni nini? Ama mko na mwakeni? Sasa hiyo sitawauliza. It's Kisii, Endelevu, Trust Initiative. Kama ingekuwa huko mbele ungeanza kujiuma ulimi. Bali ni sawa. Now, naambiwa kuna wenzetu ambao wanapima. Kama unataka kujua hali yako, usiogope. Wamefika, wako huko nje. Na leo kila mtu ako hapa. Tutoke hapa tukijua hali zetu. Au vipi, si ndio? Usiogope, na ni siri yako. Ende upimwe, majibu utapata kisiri, na whatever the result. It doesn't kill. It doesn't kill. All right. Aba mama mbara na watata. Moto wata nini? Moto wata wasadora chenjewe kidogo. Bakanje take mai kiete sawa inambara na watata. Tomanyenga mbabuwa tikito kwa na wana wase. Hita ndio na wali swali. Simutaniruhusu. Pia tuende na wao. Awa na wami. Iko tuwate wanga mbarabi bara sa tari mono seba orero ho itama no hetani. Aso musati ni moko.
Musati.
Como musati. Inobate sababu na ese na mura changia kile kile ndio.
Sababu na iwe kwa sawa ni kai waito. Na wale watu manyaki utubwa.
Yes.
Ngama ina wasacha wako ni roho waito.
Yes.
Be msimoyo. Be chwara after all. Na kule tini kukunche gwe.
Good.
Nige ndokende. Mbali kwa tina kugera na kitari kwangu. Bagenda sele churu bimu.
Yes. No, I don't comment. I what the videos. No comment. Ngero munori wete ya radio. Wa, oyo.
Aba aka. Kiwa kapesera ni kuboiwe. Kwa kiwa baba kapesera ni. Wali kutaka kusokia o tamba wali.
Yes.
Lakini abantu nabarabu kweso tulikuwa watu wa manyuma tuwali.
All right. Wangona comment hapo? Nana, what you do sana. As we prepare for other questions, yes, Omogi. Okay. You go ahead or was there? You go ahead. Good. No. Bien sana. Thank you so much. Kuna mwingine anataka kuongezea? Kuna kijana kule anataka kuongezea. Sijui kama hako Gen Z ama hako ile ingine yetu. Yeah, 1 minute. We move.
Okay, thank you for the opportunity. I'm Witi Evanso. I'm a scout and I'm also a student of criminology. And for me, I wanted to relate on what Dr. Richard said. The role of parents in combating HIV/AIDS when it comes to the youth. So, for example, when you're talking about vulnerabilities, before you get to break a stone, you have to look for the line of weakness. That is how this thing goes. So when you look at how parents handle their children, they are parents first before they are friends. And it's supposed to be friends first before they are parents. You have to be my friend before I open up to you. Yeah. When I'm talking about being a parent first before being a friend, my parent would want me to do what is good before they know if what I'm doing is good for me. That is what I'm saying. So I would really like to ask a question of what is, or maybe the members of the panel, I know you guys are sitting on high tables, what are you guys doing, even in hospitals, to ensure that our parents also get that education of how to talk to us, so that we also learn from them? Because when I come to school, like for example, right now, almost everyone who is on that table, you are almost the ages of my parents. I have not listened to my parents tell me about HIV/AIDS. Then I come to school, I get another person's parents talking about HIV/AIDS. How do you think this gets at all on me? Number two, and this one is with all due respect. Right now, for example, personally with the experience I have had, I know someone who has Lucy Damian, I guess she's the one. Lucy Damian has been doing a great job in talking to us, specifically scouts, because she is a scout, so that's where I knew her. And her engagement has been really fruitful. Me engaging with a fellow youth is really fruitful than me engaging with someone who is higher than me. Because what I can talk to Lucy Damian, I can't get that opportunity to talk to Dr. Rose about it. I don't know if that is getting the point. Now, if you look at the panel, I'm not seeing any youth that is there. And I wanted to see someone who is representing me up there. So when you are talking there and I can't see someone who I can reason with, I feel like there is a barrier when it comes to age difference. Thank you.
Those are very brilliant points. Thank you, Otieno. You say you're Otieno? Okay. I feel we should answer it first, then we come to you. Because he directed some of the concerns to us. Yes, Vitaly.
Thank you, Otieno, for those pertinent issues that you have raised. You know, Gen Z's, it's engagement. If we are to win this war on any issue, even mental health, all the issues, we have to really engage them, and they have to be equal partners. Maybe there was some omission, but there is always a start. So going to the issue you have raised about, we are Gen what? I'm Gen X. And Gen, the baby boomers, and the others. Actually, you know, we are raised up in a different environment, whereby we want, when we are dealing with the youths, we want to tell them what we want them to do. We don't want to engage them in terms of discussing and coming up with very clear solutions. But then, this issue of adolescents and young persons, it cannot be addressed by one sector. It is something that is multi-sectoral. Parents have their role, the church has their role, the schools have their role. So at every place where a youth steps in, there are roles that they are supposed to play towards improving their well-being and their welfare in society. In Kisii County, we have NGOs that have taken some work in terms of having evidence-based interventions of having parents going through series of positive parenting. And I know it is not exhaustive because they have just done it in a very small scale. Maybe it's a few, very few sectors or sub-counties. So it has not reached out to everyone. But what I'm stressing here is that AYP care should be at every level. The church has a role, the school has a role, the university has a role, the hospital has a role. And as a health, or let me say as a Minister of Health, we are trying to engage our healthcare providers in terms of training them to have youth-friendly approaches when they are handling youths. We have even come up with the programs that are youth-specific, that we can even have as a time set apart, special for youths, because youths do not want to come to the hospital and find their mothers and their grandmothers lining up and then they are waiting with them. So we have those special arrangements whereby like the adolescents and young persons who are living with HIV, because they are in school most of the time, they can be seen over the weekend, they can be seen by our healthcare providers after 5. So those arrangements are there. We are coming up with youth-friendly services, youth-friendly corners where we are handling our youths. We have so many organizations dealing with the youths. We have Darajabili Vision Volunteers. We have Nuriam Toto dealing with the orphans and vulnerable children. We have another one called TICO or Triggerize, which is also dealing with the young girls and boys, not only girls. But specifically coming to why boys and girls, why we are seeing a shift now for this World AIDS Day in this year to boys and girls is for a long time we have concentrated on the girl child, while we are leaving the boys and men behind. And we have heard very clearly from the discussions that the men and the boys have poor seeking behavior. We have also heard that wamama walisema hapa kwamba wanaume wakipatiwa dawa hawakunywi. They don't continue. Actually, it is true. Even when a man has known their HIV status, they take long before they are linked to care. We have a policy where we are saying it is test and treat, but we find so much happening that the women are ready to be started on treatment. So the test and treat succeeds for women, but men, very few. So there is in terms of the United Nations targets that we have of 95% people identified of the 42,000 that Tari talked about. We are supposed to have identified 95% of that population. And then out of the 95% that have been identified, we are supposed to have 95% of them put on treatment. And so we are lagging behind in terms of the men being put on treatment and the boys. Even when it comes to issues of PrEP initiation, the women embrace very fast PrEP, pre-exposure prophylaxis of ARVs. The women embrace it very fast, but the men are hesitant, they don't take. Such that even like in Kisii County, we had about 55% of men who are eligible for PrEP being enrolled in the quarter April, June. And then, we have talked about a higher proportion of men who interact ART. That one came out clearly to talk about the women who have spoken here. And again, the other issue why we should concentrate on men and boys. Who are the perpetrators of STDV? Mostly, they are men. That's why we are also concentrating on men and boys in this year. Men and boys are the perpetrators. And in our community, I'm sorry to say, Kisii County, it's like we have really encouraged issues of incest, we have encouraged issues of defilement, and it's normal, and it can be sorted out. Kangaroo courts can sort those things, and we just finish about it. So that's why this year, even as a county, we really need to look at these boys and men. If the girls and the women have to do well in all aspects of health, then the boys and men who are the perpetrators most times should also, we should have programs that are addressing them. The other issue is about school transition. We know from primary to secondary, we have the transition of girls is higher than the boys. More girls are transitioning to secondary school, and the statistics are showing that the girls are at 79.5% transition from primary to secondary, while the boys are at 77.4%. So that is why I just wanted us to have these key issues so that we discuss around them. And then, what about alcohol, drug, and substance abuse? Who are the most affected? Men and boys. And that's why this year we are concentrating on men and boys. Let us think of how we can address this issue to reduce alcohol and drug substance abuse among the men. I'm not saying that women don't, but the men are more who are engaging in the using of drugs. And then what about crime? Are more men in crime than women, or more women in crime than men? Men are more in crime. So that's why it's important that we also see these groups. And there are many, there are the ones who are inmates. And you know what happens in the jailers? There are a number of things that also predispose them to other issues in the cells. So I just wanted to just give an overview so that we concentrate on. Thank you so much.
Thank you, Madam Florence Ogero. And I think, yes, I come to you. She has really emphasized on the theme of World AIDS Day this year, and why we should look at the well-being of the boy child, of men and boys. And we all agree that this message needs to go beyond this room. And I'm thankful to our sponsors, Kisii, and we hope that the Kisii partners CSOs will take this message further and further. Thank you. I saw some hands there. Marong and your friend there. No, there is someone here. Yes.
Okay, thank you, Kevin.
Yes.
My name is Obulu Boseko. I'm a human rights defender based in this region. When we talk about the struggling to catch me. Okay, thank you. I wanted to say that working in the human rights field on the issues of stigmatization, these are things that are real. For example, I went to a home in Marang area, and this young man who told me, Oseko, my father is telling me hawezi nipatia shamba sababu I'm HIV positive, so mimi ni mfu ambaye nangojewa. So when I was listening to this, I was like, so after all this time that we've been doing HIV awareness, fighting stigmatization, still we have a section in our society that feels that once you are HIV positive, when you move to nangojewa kukufa, which is very wrong. Very wrong. And I asked him, and luckily I had time to sit down with him and ask him, from the time you were diagnosed with HIV/AIDS and with HIV virus, how many funerals have you attended? Akaniambia mingi sana. Na hao wenye walikufa wote walikufa HIV? Akaniambia hapana, wengine walikufa accident, wengine old age, wengine walikufa tu hivyo, wengine walikufa COVID. So I was like, now why do you want to accept the labeling that your father has labeled you? It is even impossible when you are muzika. So lazima atuwe ndio utakufa kwanza. So those of us who are working in the areas of community empowerment, I want to agree with my colleague who said that we have a long way to go. That thing I want to talk about is the gap between the young men and aspirants. Majority of us who are seated in this room, even those even the panelists, we are almost of the same age. And you can agree with me, the way we were brought up as young men is not the same way we are bringing up our young men. Our dating arena then was so different. If, for example, I was dating my sister here, sometimes I'm going to twist deliberately so that we build resilience. But nowadays, for our young boys here, our young men, the dating arena is like kuna simu hapo, kuna WhatsApp, kuna you know, the dating requirements. I remember during our time we could even walk like 20 kilometers to go and meet a girl. Na unafika huko unapata hayuko. Ana yuko lakini anachificha na kuangalia aone kama umefika kwa meeting point, then anahepa akicheka. So it was fun. So it helped us build some resilience, build some toughness of being men. Sometimes kuachwa, those of us who were in high school those days, unaandikiwa barua ya kuachwa na tissue paper. Sio siku hizi unaandikiwa message, lakini naona tuachane. Those days unaandikiwa na tissue paper, ama unaandikiwa in red, barua inakuja in red. Unasoma kwa assembly that this is addressed to Oseko. Alafu hata yule mwenye anasoma the prefect on duty anajua hii ni mtu jamaa amelambishwa. So it helped us build some resilience, build some element of uvumilivu. Ya kwamba bad things can happen and we just get prepared. That thing I wanted to talk about is what my colleague there, the young man from the Scouts. Anasema ya kwamba most of us parents hatuko marafiki na watoto wetu. Tunaogopa siku yetu kuisha mo, and the president got to badge. So there's that generation of love that we must appreciate and see how best we can bridge this gap and meet these young people and then be able to guide them accordingly. And for us parents, especially those of my age and above, it's shameful when you get a young girl young enough to be your daughter. Thank you very much.
Thank you, Bwana Oseko. Makofi kwake. Nipelekee microphone kule. Na ameleta issue nzuri sana ya stigma. I was to go there and try find out is stigma still with us. Hiyo tutaizungumzia baadaye. Wacha tusikie. Umepea nani microphone? Oh, good. Yes, introduce yourself.
Thank you, Bwana Moderator. I'm Stephen Okoto Nyango. I work for Kisii Health. I'm partner supporting Kisii County and collaborating with Kisii County. I wanted to address something, the relationship between parents and the Gen Zs. Many a times we have societal perception and societal approved topics even within our own states. How often do our parents initiate health talks, sexual health? Normally we do believe, because I'm a parent as well, though I still have Gen Alphas, and those Gen Alphas are more dangerous than Gen Zs we have here. Sometimes we do believe that when we initiate health talks, sexual health with our teenagers, we introduce them into the world of sexuality without knowing that these young people know much more than even us. So as long as, or as early as we initiate such health talks, and let us encourage preventive behaviors than stressing on abstainism, because they will not abstain. Sometimes we were sharing a forum with the parents, and we told them that if you really want to know that your son or your daughter is safe, they are in mid-level colleges, just put some sachet of condoms in their rooms and observe after 2 weeks. If the quantity is reducing, be a happy parent. But if the quantity is not reducing, be a worried parent. Because they can be using and refilling, so that they maintain a status quo that my child is okay, my child is abstaining. Men's health, what is affecting what is influencing some health-seeking behavior of our men in our societies. We have various factors that have been addressed. And sometimes there's factors we call symptoms misappraisal. As a man, I fall sick, I develop some symptoms. I will Google the symptoms. Then I will lead more towards less threatening conditions. Then I will say, this is just malaria. Let me move on. Then again, we also have coping mechanisms. Men tend to develop unhealthy coping mechanisms so long as it suits us. But we don't know that we are threatening and also affecting the entire community and also affecting our health. Otherwise, thank you.
Asante sana. Mikono ni mingi. Haya, tumalize hapo ndo tukuje hapa.
Okay, thank you so much. I'm Dr. Chieng. I teach in Kisii University. I really want to talk about something about sex education. You realize that most churches and church leaders take sex to be sacrosanct, which should be the case. But at the end of the day, our young people are more sexually active and they are aware of this. So we need not to condemn sex education in churches, but even us as parents also, we need to introduce such talks to our children. When Dr. Stella Nyanzi of Makerere University was coming out and telling the public that I'm teaching my daughter how to use a condom, the whole public came against her because this is a 12-year-old girl. By the way, when we were growing up, we knew very well that children are bought in the market. Now, our children know that our teacher has gone for a holiday to give birth. They know very well. And so, let us be open to our young people, and even as parents, talk to them, and be friends. I tell people that I think my daughter will get the first wine for me. Not waiting for another man to go and take her for a wine. My son can take the first glass of wine from me. Not waiting for another sugar mama to take him for a wine. Because if we don't develop this openness,
Kisii Poly, we have also been talking to students there. So, ningependa kuongelesha wazazi siku ya leo. Mwenzangu pale alisema youth, hakuna representative huko mbele na wacha nikuwa youth. Sijui kama nimepita kukua youth. But today I want to talk to parents. Sisi kama wazazi tumefail sana. You find most of the time parent-child communication is no longer there. So most of the time tumewachia wafanyakazi watoto wetu kwa nyumba ndio wametake majukumu. Tukikuja kwa mambo ya shule unapata walimu wetu maybe they are working hard to maybe wamalize the syllabus in good time. So how are youth wetu, we have left them in between here. Hakuna mtu wa kuelekeza vizuri. That's why you will find that nowadays the LGBTQ community, unapata wewe kama mzazi umeleta houseboy in the house, akishaondoka haujui mtu mwenye mmeleta kwa nyumba ni mtu aina gani. Maybe he belongs to LGBTQ community. Ukiondoka anaanza ku train your boy mambo na LGBTQ. Ama most of the time you find that boys are coming to your home more oftenly, and you as a parent you don't even bother asking huyu kijana anakuja kufanya nini. We have even our husbands who belong to the gay community, the LGBTQ community. Wewe kila wakati unaona mzee anakuja hapo, you are very comfortable, unasema mimi kama mama nikiona wazee wanakuja kwangu sina shida nayo, lakini nikiona wamama wanakuja ninajua wanakuja kuninyang'anya mzee. See, that is the thing in our mind. Yes, so sisi kama kina mama tunafaa kupata haya mafunzo kila wakati, na mzee wako anapoondoka asubuhi kwenda kazini, more oftenly you find that mzee akisahau akuje na one piece of condom, sio zinakwanga tatu, so amesahau akabakisha moja kwa mfuko. Si hiyo nyumba itakuwa vita the whole night. Si ni vita the whole night. So why do you have to fight and your man is taking care of you? Si unafaa kushukuru because anatumia protection. Yes, we want zero new infection by 2030. Whether we like it or not, hawa wanaume wakishapata skati mpya huko nje, ni wako mkiwa naye kwa kitanda, akiondoka ni mali ya umma. Let us agree like that. Si ni kweli? Mnakataa bado. And that is why bado tutakuwa na or infections in the coming year. So me as a woman, we keep prepare my husband in the morning, lazima nipatie some condoms atembee nazo. So akipata majaribu, anafanya nini? Anatumia. Si ni kweli? And then we have this issue of young girls. Maybe your parents hajakupatia enough pocket money, and then maybe you are tracking. Unatoka mbali kwenda shuleni to the university ama kwa shule ambayo unasoma. So when we as parents atuwapatie enough pocket money, kuna huyu bodaboda gari atakuwa anakubeba na kupatia lift all the time. So how are you going to pay that bodaboda in return? So you will be forced to pay in kind. Na sasa maybe you don't know how to negotiate about condom use. So the thing is, me wanapia wasichana, as long as you are above 18 years old, beba condom kwa mfuko wako. Sawa sawa. Just carry it. Ukipatana hata na rapist, just try to negotiate with that rapist. Mdanganye tu, mwambie hata jana nimetestiwa jana, nikatani HIV positive, and that's why I'm carrying condoms with me. Any human, any man when you go na common sense ile nzuri, akishasikia tu kwa HIV positive, even that penis will not even continue erecting. Sitalala. Yeah, so tunasema always beba condoms kwa mfuko yako, tembea nayo, try kukuwa na negotiation skills at least as we have this issue of HIV. Asanteni sana.
Makofi kwake. Saying it as it is. Ni sawa. Asante. Now I hope those who are leaving the room are going to get tested. So tutacount wale wameondoka tuone kama wamepima. Na wewe kama unaondoka pima alafu rudi ukae. Si ndio? Bwana Henry anataka kuongea lakini huyu ako next na wewe aongea alafu tuende kwake nirudi hapa mbele. Okay, sawa.
Good morning. So I'm a student at Kisii University. My name is Constance. I wanted to challenge the youth. Then I have one question to the panel, one of the panelists. So when you talk to most of us as you have discussion in it, most people say that their parents have not given them the sex education or the sex talk, or they cannot talk to their parents about these things such as HIV and AIDS. And then my question normally is, when you become a parent, will you talk to your child? And then every youth is like, yes, of course, this is something I will be doing. I see the importance of it, and so on and so on. And so my challenge goes that start now. Because there are people in higher learning institutions, they're at home, there are people who are looking at you and seeing that you are the light of the village. Talk to them. You have siblings, start talking to them now, so that when it reaches that time, when you are really like the figures of the society, or maybe you are on a panel like that, it's so easy to carry out this discussion. So don't wait until you become a parent, then you start the sex talk and all that. And then my question to the panelists goes to Dr. Lucy. She talked about why men die more and mentioned a very interesting aspect of homosexuality. So I just wanted to inquire if there is any statistics on the same, or any experiences that can be shared as to the same. Thank you.
Yes, we'll respond. I think the question has been put down. Let's see. Oh, there's another guy. Henry, hold on. Let's finish from that side, and then we come in.
Good morning. My name is Kebabe Anthony. I'm a student at Kisii University. Yeah, I'm a mental wellness activist and also a gender equality activist. So, niko na a few questions, and I'll also challenge the young people in the building. First of all, I'll challenge them. Stigma, sisi wenyewe ndio tuanza na hii stigma. For example, utapata unakuja kunaambia story ya friend ama person alikuwa tested na negative ama amepatikana with any form of illness, unakuja unaanza kuniambia story zake venye yeye mgonjwa, talking ill about them. So I think sisi wenyewe the Gen Z, sisi wenyewe ndio tuna carry the stigma in our heads and crown, alafu tunaanza kuassume sisi ndio tuko stigmatized. My first question is what can be done in the system of administration when seeking justice to GBV? cases. For example, when we talk of gender equality it's not only men and women. We find that back at the LGBTQ communities were included. So, assume I'm gay, my boyfriend, harassed, and amefanya the LGBT or whatever, and men could report. There is no administration. At the end of the day, itakuwa ni gay, sindio? What is the administration yenye imekuwa laid out for these people, these other genders? Another question is, what are the mechanisms of addressing religious persons to pass this civic education? For example, kanisani, for example, in churches, huwezi pata mtu yote mwenye amepata mimba ama AIDS unakuwa considered a sinner. First of all, you broke the laws of the Bible, that you should not commit adultery, you should not engage in sex. But now it may happen. We should seek a solution. What are the ways to engage these religious personnel so that they can address us accordingly? And the last question is the supporting mechanism my brother alikuwa amesema pale to us young people, the youth wenye tuna grow. As much as imetuletea yes this and the prep, the activities, at the end of the day, we depend on the narrow hope. What next? We should answer the question, what next? Because at the end of the day, I really need this information that umenipatia, but it's good that you are passing it for us equally, just sexual activities. So we should find initiatives kama ni mwana Kisii Endelevu Trust Initiative. Somebody said that kuna fund inasaidia this vijana. For example, I'm in a registered group, self-help group called Advertise International. We meet to draw, paint, and do poetry and sing. To keep going each and every day that niko na kitu nafaa kufanya. And also it gives me a chance to pass my activism of mental wellness and GBV as a young person. But kwa wale wenye hawajui hiyo, what can we do to put them on board? Because also pia mimi najiendeleza, siwezi manage to cater for each and every person. Yeah, thank you very much.
I think the question has become really, let's just address some of the issues raised and then we move to this side. Yes,
Thank you, gentlemen, for your concerns. I think the question I've gotten from you, your concern is how we are addressing LGBT issues as a county or as MOH. So under the leadership of our county public health in Kisii County, we do hold quarterly meetings where we are bringing various stakeholders, the police, the advocates of the High Court, the magistrates, and all other, the churches, and all other partners. We do discuss these SPV cases, the status, ni wangapi wamepelekwa kotini, what are the issues, and then we address those issues there. So we are trying to address these issues the way they are supposed to be addressed. Thank you.
So thank you. On the issue of gender-based violence, as the Minister of Health, we've done a lot. And one of the things that we've also worked with different sectors, especially Minister of Interior, where we find the DCCs and the chiefs. We've also worked closely with the police department. We work closely with the human rights defenders in this house who have had some of our cases that we give to them. We work closely with the paralegals. We work closely with the pro bono lawyers. We have pro bono lawyers who give pro bono services to the affected population. We also do what we call referrals. We network. It depends which case it is. For example, if it's a 14-year-old girl who is pregnant and we need to pursue that case, we have safe houses where we take them. If it's within Kisii or even outside Kisii, we have some network where we network. And also we have the component of prevention. And that's why, in fact, we are here today. The component of prevention. How can we prevent? What is my role? What is your role as a youth? What is your role as a mother? What is your role as a lecturer in Kisii University in the prevention of all these forms of gender-based violence? And then I want to talk to Otieno. Otieno, you mentioned something on how we can empower our young people. In fact, we've done that. You mentioned an example of Lucy Girl Power. We've trained different AYPs. AYPs are adolescent and young persons who are our champions in different institutions. For example, in Kisii University, we have champions that we've trained. If it's in Kisii National Polytechnics, we have champions who we've trained. And we have even our youth-friendly centers like the one Florence mentioned there. We had one supported by Daraja Bili. Ile iko pale inaitwaje? Kisii Youth Wellness Center. That is where we have you people, where we can engage one-on-one. Najua kuna vitu hatuwezi sema kwa hii hall, but when we're seated together, you can engage with us. So I call upon every stakeholder, hata kama ako hapa, hata kama hayuko hapa, so that we can work together. And if we end GBV, then we're here in the right trajectory of ending AIDS in 2030. And also, if we had GBV, then we are reduced even the teenage pregnancies that all of us have mentioned in this hall. Thank you so much.
Allow me to add briefly. I want to support the young people, and my colleague who talked about parenting. I always say this: the best school is the home school. So parents, let us open up our space and talk to the young people, to our children, because we give the right information that we want them to have. So that is on parenting. I know in our society we do not have maybe many organizations dealing with parenting empowerment skills. If the county can also take up that, I want to throw up that challenge to the county also. Please take it up, but parenting is very important. And remember, these parents are also bringing up parents in challenging times. Two, in the university, we have various programs. I know they may not be satisfactory, but we always try our best. If like now we are talking about HIV, this is a program that I actually expected many students to turn up. And we have a full hall. But you see, even up there, we still have spaces. So I want to urge students, young people, please also seek out for information. Get information. Send yourself to places and get information, because there are always people who are out here to support you. We have games and sports and many other activities, and I have seen the dean of students in the house. I want to kindly allow me just to give her maybe 1 minute to tell us what programs are there with our colleague Edgar. I know they do a lot of stuff with students. Back in the faculty, we also do a lot of mentorship in terms of academic, just to keep our students busy. We do a lot of awareness, and therefore my colleagues who work closely with students, maybe you could also tell us what programs are there, because some of the students may not even be aware that these programs exist, but I know they are there.
Thank you, Daktari. The dean will talk about the programs, but I'll just like to cast a further spotlight on a question that was asked. I don't know if it's going to be answered, but I'm curious how it's going to be answered. The gentleman who was speaking earlier, and he gave, where we are in society, I feel we are at a nexus of change. We were here maybe 15, 20 years ago, and the nature of human beings, the nature of the African society, especially the nature of Kenyans, there are things we don't talk about, and we just bury our heads in the sand, and we assume and hope that they're not happening, but they are happening. They are covering us, they are affecting us, they are affecting our young people. The rise of the Gen Z revolution that was there this year was unexpected. Nobody thought it could actually happen, but it did happen. So I want to piggyback on a question that came back before I hand over this to the dean, just point out one or two questions, one or two programs that we're doing. It's double trauma, and it's double problems, and it's double shyness to someone who is in the LGBTQ community getting harassed. Because one, admitting you were harassed, or admitting you were raped, or sexually harassed is first of all a problem. Now, admitting that that happened by someone of your gender, with or without your consent, is double problems. And if we find a safe place, and I know this is not a conversation we have often, but the reality is on the ground, if you actually open your ears and listen to these young people, these things are happening. And we are where we are when HIV was coming to be. At the beginning, when we were begin to know about it. Because there's a time, if you had HIV, they would throw you in the bush and you die there as the community continues. Or they will hide and pretend and until facts came down the road. 15 years later, we now are trying to continuously say it is okay if you have HIV and AIDS, we can manage it. You can have kids. You can continue with life. But 20 years ago, we forgot about it. You were thrown away. You were a misfit to the society. It's like a tragedy has fallen upon you. Today, we are at the same point with different issues. Same problems, different generation, same people. They are afraid to talk about this. How can we give them an avenue to be able to talk about it? Because the reality is this, no matter how much we try and say they're not there, we know they're there. They are there. Some of them are very active and they're out there that you can totally see, but others are hiding. And you can imagine if it is hard for a girl to come out and say, so and so raped me. Now you can imagine how hard it is for a guy to come out and say, so and so raped me and gave me HIV.
They identified a gap and they are out here and they are out there. To do what? To fill this gap. So as young people, as old, between just whatever you have identified as a gap, be deliberate and try to fill it so that we don't say we have empowered the ladies, the men are on the edge and they are suffering. Yes, we are wired differently, even psychologically. I have a man in my house I've lived with for more than 30 years. Even a call, Homa, say you can mix a concussion and take, even before you do what? You go to hospital. My God, even that one alone. Now, what are we talking about? Now, taking the regimen. Keeping that particular time you're supposed to take this medication and do all this and all. They're wired differently. And that is why, when you are close to a man, you come in to fill the gap. Thank you.
Thank you so much. We're going to Makofi tomorrow. We are almost finalizing. We have less than 10 minutes. I come to you. Yes, I can see the time wants to respond. But I'll before you do, I also wish to what the gentleman Edgar said, that some 20 years ago we had misconceptions about HIV. Now, but my question will be to all of us here, that now that we have information, we have medication available, has this information and medication made us careless? Has it maybe contributed to more infections? That's another challenge that we need to look into. Yes, Deacon.
Yeah, thank you so much. There was a question on men having sex with men. It is true, they are there. We have people doing research and they have found the easiest way to get kwa ajili ya wale pengine Kiswahili kwa more comfortable. Tuna watu ambao wamefanya utafiti na wamepata, ukitaka kufikia wale wanaume ambao wanakuwa na ngono na wenzao, tunafanyanga kitu inaitwa snowballing. Unapata mmoja anakuongoza na kuambia na kuanga na furani. Na kwa hivyo hapa Kisii
kuna wakati tulikuwa na mkutano, kuna mtu anawafuatiliaga. Kwa hivyo the county has the statistics. Tunajua ni kama idadi ngapi ya wanaume hapa Kisii wanakuwa na ngono na wanaume, na kwa hivyo wako. Swali ni kwamba wanaume kweli wako haraka kujitokeza kusema niko na urafiki na wanaume, na ni vipi tutawafikia ili tuwaambie kwamba hata wao ambao wanakuwa na ngono kati wanaume kwa wanaume, ili tuwaambie wako at a higher risk. So we need to reach out to our men, and now that we are thinking about men and boys. Sio rahisi sana kwa mwanaume kusema ninakuwa na uhusiano na mwanaume mwenzangu. Hata kanisani watapigwa. Wakienda pale waseme nina makusudi ama natarajia kwenda kuoa mwanaume, watapigwa. Hata wewe, hata mimi kama mama, maisha niletee kiume kingine aniambie ndipo anataka kuoa, nitapinga. Lakini tunasema wako pamoja nasi na lazima washughulikiwe. We have to think of a way forward because we are thinking about men and boys. I think somebody from the county will handle on that. But I want to talk about something about this stigma in men. Wale tumekuwa katika kupima HIV, unapoona reaction ya mwanaume na mwanamke, jinsi how they react after they turn positive, it is quite different. Most of the women, when they turn out to be positive, most of their emotions sometimes is to cry, and we allow them to cry. And even after counseling, you'll find most of them will cry. But there are very few men who will cry after they turn out to be positive. And I would want to ask Dr. Rose, how will men be helped also to cry? Because crying also is medicinal. Can men also be taught to ventilate by even crying? And then I have this other issue of men. If a man goes to the hospital and tests and turns out to be positive, and the wife turns out to be negative, what is normally the reaction in the community? Si huyu mwanaume anatangatanga sana ndio sababu amepata ukimwi, si ndio? So somebody was asking, is stigma still there? So stigma is still there, and in the church, we have a few of them in church and we know them. When a woman says she's positive, and when a man says he's positive, the way the community looks at them is quite different. And therefore, boy child is still having a lot of stigma in the society. How can we help these men? Even when they get medication because they are positive. And maybe most women will go and talk in a chama, where women go to ventilate. Women have got a lot of areas where they can go to ventilate. Unaenda chama, unaongea na wenzako. But how many men are able to share this information about even their sexuality with other men? So you find men are going to drink ili to release tension, sindio? So I think we still have a lot that we can be able to do. Our son there was saying that we don't have the youths to represent them. The Dean of Students did say that in Kisii University we have a lot of peer educators, and we give them a lot of education. We had a whole week with them, we have trained them. We even have counselors from the Dean's office. So information is out there, let us look for it. And I feel to society. I want someone from the county to talk about men having sex with men.
Thank you. We really don't have time. We don't have much time left. But because we at 11:59, I was supposed to stop at 12 sharp. So I only had 5 minutes. Na wale wengine ambao tuliuliza mko mnakunywa chai, naambiwa kuna chai ya kuja, msitoke kabla tuende kupika. Si ndio? Let's proceed. 5 minutes in.
Okay, sasa swali ambalo limeulizwa, let me confirm to you that we have a robust key and vulnerable population program in Kisii County. which looks into the welfare of people, key populations. They are called key populations because they mingle with the general populations. And this program is meant to reduce the HIV transmission between the two areas. So in Kisii County, the population size estimate of 2021 gave us an estimate of 6,538 female sex workers. But according to the program, we have surpassed that population size estimate to a tune of around 12,000 female sex workers in the whole of Kisii County. And then for the men, MSM, men who have sex with men, the estimates gave us 737 as the estimate supposed to be in Kisii, but we have surpassed that estimate. We are talking of over 2,000 men who have sex with men in Kisii County. We also have another category of people injecting the drugs. The estimates gave us 36. We are somewhere there. And then there is another population called transgender. The estimates also gave us 63. So as a county, we have that program to ensure that even as they mingling with the general population, there is a reduced transmission of HIV. And that's why that program is there. We're working with other implementing partners within the county. And then there's a youth who just asked about the engagement of the youths. As a county, the Ministry of Health is working through NASCOP. And again, we also have NSPCC as the overall coordinating multi-sectoral response. So in every sector, we have an AIDS control unit. Even in Kisii, we have an AIDS control unit. And it was a requirement, even in the other ministries. And there are AIDS control units which coordinate matters of HIV programming in the school, in the institution. And that's why we have clubs, we have societies. In the county, we have networks of people living with HIV/AIDS. We have other networks. We are working with the Ministry of Education, Children's Department, Tibet institutions. All this, we are working with the government institutions that are even ensuring that we have bursaries for the vulnerable children who cannot go to school, the CDF fund, some organizations that are doing Dignity Kids. They are giving support to the young and vulnerable children in the county. So it's a whole range of services that are provided just to ensure that we are bridging the gaps that we have in terms of AYP care. So because of time, I think I will hand over to the director to request.
Yes, we are finalizing, but there were questions there. I don't know. I only give a chance to just one question. And again, as the director prepares to respond, I had asked about this issue, the information you have, the availability of medication, and if AWIN is handling this information, and are we also misusing the availability of this medication? Yes. Maybe inapelekea kupata maambukizi zaidi. And then Madam Flores, I thought because you're handling the issues of STIs sana, that ungeangalia some other STIs which are maybe they are misinterpreted. I don't know whether this is the right term, but kuna STIs ambazo tunapata, mtu anapata na anasuspect ya kuna HIV. I have a case, I think someone written a message here that someone alijifikiria, akajipima, akaona kuna some STI, akafikiria kuna na ukimwi na akaanza kutafuta dawa. Yes, I think you also talk two STIs and then tumalizie. So Advertise, respond.
Before I give Florence to respond to that, something in addition to there is a question that was asked about LGBT, or rather the men who have sex with other men. One, initially I said if you compare women and men, the risk of contracting the virus is much higher in women as compared to men. Now, if you compare vaginal penetrative sex and anal penetrative sex, again, the anatomy is different. The epithelial lining of the vaginal wall is thicker, of the anal lining is very thin, and you will always get tears and tears, and therefore it is almost 100% transmission risk if you are having anal sex. So that is one thing I wanted to add. Secondly, because I may not have a chance to speak again, let's understand that the first case of HIV was diagnosed in 1981 in Kenya in 1984. Over the years, the successes we have had is because of funding from the donor community. That funding is going down. In future, we are not going to have that funding. It will be the government of Kenya to do that funding. And therefore, we need to wake up and have these preventive strategies put in place so that we can prevent or end HIV as a public health problem. The information is there. We now know what is HIV and how to prevent it. Let's make use of that information. Even these youths, I had the dean of students saying you have very many clubs. This information is there even if you Google. So make use of that information and let's prevent HIV. You asked a question about whether the availability of drugs and all this is leading to the more infections. Number one, the aim of our program is to, the final outcome for those who are HIV positive is to ensure that they are virally suppressed. And I told you once you are virally suppressed, you cannot transmit the virus. So from where we sit, we want to ensure that everybody under our care is very suppressed, such that even if they go, misbehaving around, then they are not transmitting the virus. But there is one intervention that is usually abused and by new youths. You know what is PEP? What is PEP? Post-exposure prophylaxis. We usually have it there so that if there is an accident, if you probably are raped or probably defiled, then we can give you that medication to prevent the transmission of the virus. Unfortunately, our youths are engaging in unprotected sex intentionally. Then they'll come in the morning and tell us, oh, I had a condom burst, oh, I had a what. So they are really abused to that, to the extent that KTRH, our biggest referral hospital, is leading in the use of PEP in the whole country because of that. And it is mostly by youths from our learning institutions. But there's nothing wrong. For us, we want to prevent the infection. We'll still give you the PEP. But please act responsibly.
Thank you. We are finalizing. I think I get, for those who have not had the opportunity to speak, to just have one word tumalize. Utanisamehe ama lazima uongee? Kuja hapa mbele. Kuja hapa mbele. As we finalize from their side. Yes, madam.
As he's coming, to add on what Dr. said. So instead of you being on PrEP continuously, just come for PrEP because you're planning to have unprotected sex. So come for PrEP. And then you protect. Then on STIs, sexually transmitted infections. You know, even HIV is a sexually transmitted infection. We have others, you know them, and no need of mentioning, gonorrhea and the rest. As a country or as a ministry, we are managing those syndromes, those infections in terms of, we are doing syndromic management. And the only way, if one has any symptoms of sexually transmitted infection, it is safe just to go to our hospitals. We have private, we have public hospitals. You can be diagnosed and you can be put on treatment. But for HIV specific, do not diagnose yourself by feeling or looking. You have to go for testing. We even have the HIV self-test kits, which can be given. Somebody can test themselves and come to the facility for further confirmation. To the HIV testing centers. We have so many. Every of our facilities, and including other standalones, are HIV diagnostic centers. And apart from testing, you're tested, you're put on treatment. So we are also using treatment as for prevention, because we have said U is equals to U, and undetectable is equals to untransmittable. So for those who are HIV positive, they are put on ARVs. They are virally suppressed, then it means that we are preventing transmission of HIV. Thank you.
Thank you so much. We are having a final question and then we wrap up.
Now, mine is some of us are rubbish. There are those of you who are very Christian. Wale wengine sisi tunakaa town mpaka saa 6 saa 5. Na kwa sababu sisi culture yetu, kwa sababu sisi kanisa yetu ile ambayo tuko ni nzuri, nataka niwaulize wale wasichana wanapanga town pale wengi, because we are talking about HIV prevention and we are here pretending like and burying our heads in sand. Wale wasichana ni wakina nani? Wanaenda kanisa gani? Wanatoka kanisa gani? Nataka nimalizie swali la kwanza, nataka niwaachie mniambie kwa nini tuje hapa tuwe tuna pretend. Question 2. Who are these that go out during the night? And who are these that go to church? How are you able to differentiate those who are in the church and those who are out for night outs? I wanted to advocate and ask our girls, when you go out, don't go to any party unless you are invited. And I want you to do this. My dress, my choice during the day. But at night, even if there is a possibility, be an overall, be in a jeans, stay tight, stay safe, girls. Outside there, we are very bad. We are very bad. I want to ask the duty bearers from the human rights perspective. I am a lecturer, I teach. The rest of you have offices. How do you handle your clients, the boys and girls who come to you, to protect them on their rights? Because on our human rights perspective, where my right ends, it does not need to go beyond the other person. How do you offer your services such that you can be able to encourage and make these guys develop their ego, develop their self-esteem? How do you handle them such that they also feel worth? Because many of us as parents, we handle our children like trash. So I'm trying to challenge those of us who are in the house to change our ways of handling the youth, because they are also human beings and they are very, very, very critical in getting our destiny. Finally, I want to say this. There is data protection. Simu yako yenye umenunuliwa, simu yako mama yenye uko nayo, simu yako baba yenye uko nayo, bibi yako, bwana yako, mtoto wako ana ruhusa ya kuiguza wala kusoma ujumbe uliopo katika simu yako. Because these are the small things that because of maybe a stray message unanyongwa. It is because of the message mwepiwa pita penye umeenda out and you are in a group of boys. The man who the sponsor of the sponsor sees this and comes to kill this. So the best that you need to do, protect your data, and it's a right inside our constitution. Si hata askari, si lecturer anaruhusa wa kufungua na kupata your password to your phone. I raise my case.
Thank you so much, Bwana Omwere Henry. Mmepewa makofi mazuri kweli. Especially hapa kwa simu. Hapo kwa simu umeingia. Good. Now we are coming back to our panelists. Kindly I give you a few seconds to everyone, starting from the far end. I will start with Mr. Oh, he's on phone.
Yes.
Okay.
Sorry for that. I have admired the way we have had this conversation, and I believe with our partners that we are looking forward to be having more of this. But overall, what we have said, we are being guided by government policies and guidelines and strategic plans. So one of such strategic plans is the Kisii strategic plan, which is 2 years coming. We are not wrong days. So then we need to familiarize ourselves. Those things are there in our video. Let's go and see what the policies. Because whatever we are implementing, we are following the government policies for the national and the county government. Otherwise, I'm very happy for you. Thank you so much. Thank you for Kisii. I'm really happy for you. Thank you.
All right, that's Richard Promosi. He's a coordinator of county multi-sectoral coordinator in matters 8 in Kisii County. It's Kisii TV. Thank you. Yes, Richard.
Thank you so much for coming to Kisii University. We need to have this more often and even to a big audience. But my parting shot is that let us be responsible, test all the time. If you are negative, maintain your status. If you turn out to be positive, it's not a death sentence. Take medication and take care of everybody else. But kindly come for testing where you can be medically tested. Don't test with eyes. ARVs these days are endless. People who are positive look very healthy. In fact, you can't suspect. So just go for testing. Be sure. For our youth people, when you get a partner, when you want to get married, kindly test. Don't see that somebody is big enough and you think they are free. Come for medical testing. Thank you.
Thank you, Dr. Lucy Karani. She's the coordinator, AIDS Control Unit at the University. Yes, Madam Florence.
Florence Ogero, the County AIDS STI Coordinator, CASCO, in short. My part in short is that treat everyone as HIV positive and you'll be safe. You so that you can use protection and you can do what is necessary. And for those who are HIV positive, it's not a death sentence. Let us continue with our treatment. We can prevent onward transmission of the virus. Thank you.
Thank you.
Thank you, Masemo Lydia, the Deputy County Product Health Coordinator. Just 30 seconds, I want to answer my colleague, the gentleman. You mentioned issues to do with the men having sex with men, on how we perceive them. Our healthcare workers from now, the Ministry of Health, they've done what we call value clarification, attitude transformation. When they come to us, we handle them the way they come. Not that they are MSMs, we don't give them assignments. In fact, we empower them on how to prevent themselves further and even give them the other intervention measures on how to prevent the new HIV infections. My part in short is, let's all prevent the triple threats. That is the new HIV infection, GBV, and teenage pregnancy. Thank you so much.
Yeah, thank you very much. I'm excited to be back here in Kisii University. I did my MBA from here, and Prof actually signed me off. That time in 2014, he had just come back with his PhD, and he was very proud. From a class of about 15, only about 4 months graduated, because he went ahead and asked us to get him the raw data that we had. He went to the SPSS to find out whether those p-values we actually reporting are actually the correct things, and most of them failed. So I'm very happy to be back here. Thank you for showing up. We need to fight this epidemic together. And as we've heard, we have a target to end AIDS as a public health problem by 2030. And the Ministry of Health cannot do that alone. So my parting shot should be to everybody that please go out there and get tested if you are not tested, and do it on a regular basis, on a yearly basis. Some years back, we as doctors or healthcare workers, when we did have ARVs, it was very difficult to convince somebody to get tested because we didn't know what to do with the patient. Right now, we are telling you, once you are test positive, we take care of you. Take care of you until you grow old. Okay, so get tested. Number 2, to the men, don't be scared to know your status. It is not a weakness. It is actually a strength. Please find out whether you're positive or not and take guidance. For the youths, remember you are our future. Young man, you are our future. And we need you to be responsible, act responsibly, know that HIV is there and you can actually contract it if you're not careful. For those who are living with the virus, we support you, we encourage you to make sure that you take your medication as prescribed. There is life after being tested positive. It is not a death sentence. Thank you very much.
Thank you.
I'm happy this morning that we are talking about HIV and we are bringing on board discussions on mental health. There's a strong relationship between HIV and mental health, and therefore we need to integrate this conversation. Getting a diagnosis of HIV means a loss, and a loss of the sense of well-being. However, it's not a death sentence, and it means that a person who has had a diagnosis of HIV may feel stressed, depressed, those mental health conditions that may come with bad news. On the other hand, having a mental health problem can actually predispose somebody. It's a risk factor for getting HIV. For example, using drugs can actually predispose somebody to HIV. Because there are some drugs that are injected, that method of injection. If you use unsafe ones, and of course, once you use alcohol and other drugs, poor judgment. So you may not make the right decision about your sexual life. And my parting shot is that mental health is very, very important whenever we have a conversation on anything. So I want to urge all those who have attended today, seek out services, mental health services, screening, testing for HIV, so that you know your status. When you know your status and you are feeling stressed, we are available. Finally, I want to ask the county to really integrate the screening of mental health problems to HIV testing. And so that clients who come for testing also receive mental health support. Otherwise, in this county, I'm always at the forefront for advocating for mental health, and also in Kisii University. Let us embrace mental health all the way right from home up to the community level. Thank you.
Thank you, Daktari. Situwapigie makofi tafadhali. Great honor to have you, our panelists, na ungetusaidia sana kuelewa haya masuala. Na finally, I thank everyone who took part in this discussion, our panelists, our sponsor, Kisii Endelevu Trust Initiative, and the partners, the member CSOs, and all stakeholders who are represented here. Thank you so much. And the partners that made sure that we are here. As I invite Bwana Mayo, I ask that he prepares to come forward for a closing remark, but I must indicate that we were able to be here because of Katie, as I mentioned, and the other partners led by National Syndemic Diseases Control Council. Thank you so much, Kisii County Government, USAID, Katie itself, KCDF, Kisii University, and everyone else. So, Mr. Mayu will make a closing remark. He will do it on behalf of the DVC who left. He is a member of the AIDS Control Council and also a lecturer at the university. Welcome, sir.
Thank you for all that have come. Today I was quiet because my voice is not the one I like most. I want to take this opportunity to appreciate each one of you here who have come here today. Specifically, Keki, for recognizing that we are the higher institution in this region that we should lead from the front. I want to appreciate all the panelists who have just given us what it is. The members who have particularly brought out everything black and white. It has not been easy. Some of us who were born in the 70s, we are born Generation X. We saw how stigma was stigma. I want to tell you it's no stigma nowadays. The plate you could use eating when you are HIV positive, it was thrown out immediately. Nobody could share it with you. Let us come out and do it. On behalf of the AIDS Control Committee of Kisii University, allow me to appreciate you and let it be regular. Thank you. Thank you. May God give us that energy I want to tell you, test yourself, go to the hospital for confirmation if you fear. Blink your left hand. Normally I blink this finger. I blink this finger is safe than all other fingers. Blink, then go confirm. I'm telling you what it is. It's not a job to test. It has fear. Even those ones who know that you are not having it. Take a bold step. Let's walk out and test. Is that okay? That's when you can prove we have received the best. Thank you very much, Captain Omayo Francis, a committee member, Kisii University AIDS Council. Asanteni sana. Biamono erokamano.
Asante sana. Do we agree that all of us are going to test? Wangapi hawata test? But anyway, thank you so much, guys. My name is Kevin Mumburi. I'm a radio and TV presenter and also founder of 2 stations in this region, Kisii TV and Getembe. And today we have Getembe TV, we are live, and we will also show some of the clips later in our station and in our news. Thank you so much. I appreciate the opportunity. Na naambiwa kuna chai ya kila mtu, so msiondoke. Asante sana. No. Kendi, Asha. We have done a closing remark, but when we're here, Kendi, you can also do your...
Thank you. Thank you so much. Do we have a leader from the Students' Council? Student leader, kama kwa room. The president, any representative, because I saw them raise an issue that they want to be recognized, I think that will be prudent enough. Yes, the gentleman can speak on behalf of the students.
To our guests, Dean of Student, and abstention, the lecturer, good morning or good afternoon. Okay, my name is Joseph Owima Osemba. I'm the Secretary General to KSUSA, the student union. I really thank you guys for attending such an event so that you may learn how to protect yourself and prevent HIV and AIDS and other sexually transmitted diseases. It was unfortunate that most of us had classes, that's why you never saw maybe another group coming. But as we continue championing for this, I know 1st of December will be the AIDS day. We'll get to bring most of the students to be sensitized on the same. Then the way you have championed for this day, I wish that you continue empowering the peer counselors and the rest to reach out, create reach out activities, even going door to door to the comrades. You know, maybe some comrades when they hear about AIDS, they fear coming here. Maybe you can organize with them so that they reach out even in their residential areas. Meanwhile, we'll continue championing for the same. Thank you.
Yes, thank you so much. So my name is Asha again, Moronya. I'm the programs coordinator for KT, Kisii Endelevu Trust Initiative. We are currently running the USA Debora Machinery program, and we are happy that this session has come to a very fruitful conclusion. I thank everyone for making time to be here. Our team from KT, you've been so supportive, especially in giving logistical support. The university team, our partners in the plan, so tunawashukuru sana. So as we wind up, we have some refreshments for everyone. So the students, the partners, and the participants in this session, musisonge, as the rest of the panel probably move to some other section for that arrangement. Yes. Wengine mutabaki kama mmeketi. We are going to sort you out with some refreshments, and there are those who are invited also by use of a text. After wengine mmepatiwa soda na something small, the rest, those who are invited by use of text, mutabaki nyuma. We'll have some session with you once again. Thank you so much, and God bless you.
Yes, to add on that, tea that is available for the panelists and other partners to either access. Yes, partners from the AIDS control unit, the university, student leadership, Upando Buju, KUSU leadership, and public relations department tunaenda hapo tu. Wengine wanabaki hapa, we will be served from here. Thank you so much. God bless you.
In the university, and I'm also the programs coordinator for this program that we dubbed as USA Ubora Mashinani Program, which is a 5-year program funded by USAID, and we are the team that is implementing. Our name is Kisii Endelevu Trust Initiative. The program runs in 10 other counties in Kenya, but our major focus is on 4 key areas. One is to support our community. Support our community members to engage with the duty bearers at county level by giving you a voice so that you get the power to negotiate and also contribute towards development priorities in the county. Number 2 is also to build capacity of our member organizations, our communities, so that you are also able to run your own initiatives with the proper capacity. We also have other areas of peer-to-peer learning, collaborative and adaptive learning amongst ourselves and our partners. And that's why we are here with other partners like the National Endemic Diseases Control, the Kisii County Government, Kisii University, and other players within this orientation. And lastly is to participate in the national grid in our country so that we are also able to contribute to the policy framework of our nation and also engage with the private sector players. We are here because of the forthcoming World AIDS Day commemoration, which is set for 1st of December. And this is just one of the activities that is gearing towards the actual day celebration. So we are happy that you are here today as young people, as members of the community. We have 80 member organizations who are here. And we have Kisii University, which I want to thank for hosting us. Professor Gato, you've been my dean for some time, and now you are the registrar. I'm happy that we are having this collaboration. And as we move forward, I want to thank you and hope that we are going to have a fruitful and meaningful engagement as we move along. Thank you so much, and back to you, moderator. Asante sana.
Asante sana, makofi kwa Asha. Safi. Sasa tunaenda kwa lile ambalo limetuleta hapa. World AIDS Day. Mbona tunasherekea ama tunakumbuka ama tunakumbushana? Nitaanza na daktari kwa sababu uko karibu nami. Tunasherekea ama tunafanya nini? Na mbona kama tunasherekea, mbona tusherekee ugonjwa ambao unaleta matatizo kwetu?
Thank you. Good morning, everyone. World AIDS Day. For me, I want to look at it, and that's what I'll be dealing with psychological perspective of it. HIV/AIDS came to us, and there has been a lot of stigma. So for me, a day like this, we take great opportunity in reducing stigma, destigmatizing HIV/AIDS, so that we look at it just like, even the way we talk about diabetes, hypertension. So I hope after this meeting, we will all be able to destigmatize HIV/AIDS.
Makofi kwake pale. Makofi kwa daktari. Kuna mwingine ambao kuna cha kuongezea? Yes. Daktari.
Good morning. Yeah. #EndAIDS by 2030. I wish we could go and write #EndAIDS by 2030, which is our aim. But going to the question that the moderator has asked, why we are commemorating this day, is to remember the gains that have been made in HIV response in the country, worldwide and even in the country. We are also remembering those who have lost their lives through this disease. We are remembering the many who are living with this disease and they are living positively. So it's just a celebration of the gains that have been made and making us stride forward to improve the response, reducing stigma, reducing new HIV infections, and reducing AIDS-related deaths. Thank you.
Asante sana. I would like to pass this microphone now to our County Director for Public Health and Sanitation, because we need to know where we are. As far as HIV AIDS prevalence is concerned, tuko wapi kwa sasa? Daktari, mkono.
Yeah, thank you very much. As you had heard, my name is Dr. Kware Richard, the Director for Public Health and Sanitation, Kisii County. It is important, first of all, to recognize this year's international theme as being My Health, My Right. And why this theme is that we aim to reduce inequalities in accessing health. There are those group of people who live with HIV/AIDS and are unable to access these services. So as a country, our national theme is aimed at looking at these groups that are not accessing these services well, or their outcomes are not as good as expected. Now, that is why we are interested this year to look at the health outcomes of the boys and the men, because despite the prevalence rate among men being lower than women, it is the men who are dying more. Secondly, we are interested with the triple threat. There's something called triple threat, especially among the youths. And these three threats, number one is teenage or youth pregnancies. We are looking at the new infections, especially for the youths between 15 and 24, and I believe most of you are within that age bracket, and gender-based violence. Okay? So that is what we are looking at this year for. So for Kisii, the statistics as they stand today, we have made a lot of progress in trying to control the HIV/AIDS pandemic. If I take you back 10 years, the HIV prevalence was as high as 8.9%. Currently, it is at 4.4%. That is a remarkable reduction in prevalence, though that prevalence is still higher than the national prevalence of about 3.7%. So there is still a lot of work to be done. So if you translate 4.4% into numbers, we are talking of about 42,000 people living with the virus today in Kisii County. And out of those 42,000, we are able, as a department and other partners, to put about 40,000 of them on treatment. And out of those 40,000, over 95% are virally suppressed, which means they are responding well to the medication and they are living a healthy lifestyle, and they are unable to transmit this virus to the next person. Okay? Then there's something else called mother-to-child transmission. Those pregnant mothers living with the virus, we also monitor at what rate are they transmitting that virus to their born or breastfeeding children. And that has also improved. 10 years back, 17% of all the pregnant mothers who are also HIV positive were transmitting the virus to their born or breastfeeding child. We have been able to reduce that down to 6.7%, but the national target is to have less than 5% of the mothers transmitting that virus. So yes, we have made a lot of progress, but there is still a lot of work to be done. And more especially for the youth, as I've told you, the new infections, you are leading in the new infections. As in, if we look at the whole year, we look at how many new infections we have and categorize them into groups, then we get that youth between 15 years and 24 years contribute significantly to the number of new infections. So as we are here today, we need to discuss that with you. Thank you very much.
Thank you, makofi kwa daktari. Lazima tujue kama tunafuata chenye tunafunzwa hapa. Daktari amesema we are leading the youths who make a majority of the audience here. You are leading for new infections. Amesema between which age?